Could the food under this silver dome help couples have a baby? Yeah. What is it? Seafood! Yes, indeed. Compelling new research suggests couples who eat 2 servings of seafood a week may have more success conceiving. Reproductive endocrinology and infertility Dr. Carolyn Alexander and her patient Tara join us with more on these findings. Dr. Alexander, got to ask you this because this is important. You do this for a living. Are these findings significant in your world of expertise?
Definitely. I see a lot of patients and women and men who are trying to conceive, and I really believe that fish has vital nutrients such as omega-3 fatty acids, lean protein, vitamins, minerals such as iron, and iodine, which is really important for the thyroid. There's a recent study looking at men who actually eat more white fish had a better sperm shape, which is really important for when fertilization into the egg occurs. And if they eat dark fish as well, the actual count was 30% higher than men who didn't eat any fish.
Now, when you say dark fish, what are you referring to, Dr. Alexander?
Cod and halibut is white fish, and some of the tunas are darker fish. Wild caught salmon that's darker is actually also better.
Good, because I like salmon.
Okay. And then Tara, tell us your experience with this.
So I was really adamant about having good egg quality, and I doubled my weekly intake of seafood, from oysters to scallops to shrimp to anything within the realm of what Dr. Alexander recommended, and I had an excellent outcome.
So Tara, tell us about your great outcome.
I was really adamant about everything going the way it should. And after going to multiple ultrasounds and Dr. Alexander looking at the quality of what the eggs look like on ultrasound, or the follicles rather, once they retrieved the eggs, she went over them with the embryologist and they fell into an ideal category.
Wow, so this was when you were having your eggs frozen? And
correct.
Got it.
Correct.
So on the one hand, it's a really good idea to increase your seafood consumption, but on the other hand, certain fish that are really high in mercury can be quite toxic when you're pregnant. I know during pregnancy, I was told to avoid them, along with shellfish, because of the possible infections you can accrue from those. So what do you advise your patients? What are some specific recommendations?
So I tend to say use about the size of your hand per week when you're pregnant, 2 servings, and more fish that are less mercury, that have less mercury, such as white fish, wild-caught salmon. Shrimp is actually low mercury, as well as white tuna, but it has to be light canned tuna versus the darker tunas.
So if eating fish a few times a week in these studies seems beneficial, talk about a few things that have the opposite effect.
Bacon and some of the deli meats have a lot of sulfates and nitrates in them, as well as certain sausages that have been really cured. Those can really have a harmful effect on sperm quality, as well as perhaps egg quality, and we don't know, but sometimes ovulation may be hindered when our diet is including a lot of those foods, including fried food and a lot of foods that are processed.
How about oysters for men, fact or fiction?
I think everything in moderation. I know that for certain men, they do feel a boost in energy and sexuality. So I think anything in moderation.
Maybe that old placebo effect. I know when I down that dozen oysters.
or maybe you're just
whatever.
Well, I want to thank both of you so much for joining us and sharing this with us. Drew, do you inject your oysters with B12?
No, I don't.
You know, it's interesting on this show, we often talk about letting food be your medicine, and that's certainly true if you're trying to get pregnant, and not enough people think about what they're putting in their bodies if they're trying to conceive. So I just think this is another wonderful reminder of that.
I think fish is a great angle, but I think just in general, a great diet, balanced diet.
Lower in terms of processed foods.
Fruits and vegetables, exactly.
Good stuff.
And universal, men and women. You're saying this helps both genders, so why not?